Good evening. Thank you for watching 10 News at 6. I'm Robin Wilhoit.
And I'm John Becker. New at 6 tonight, the Senate is voting right now on a spending plan from President Trump. Supporters say it will trigger an economic boom. Critics say it will cause even more pain for Americans struggling to meet their basic budget for food, rent, and health care.
Well, tonight we look at the impact on health care, and list compiled by the University of North Carolina outlines 300 hospitals across the country at risk of closing if cuts are made to Medicaid. 9 of those rural hospitals are in Tennessee, 35 are in Kentucky, more than any other state on that list. 10 News reporter Olivia Daig spoke to the CEO of Middlesboro Appalachian Regional Healthcare, that's in southeastern Kentucky, about the concerns he says could be detrimental to rural communities like Bell County.
If approved, cuts to Medicaid could impact or close 35 rural hospitals across Kentucky, according to data from the University of North Carolina. Now, one of those hospitals is the one right behind me, Middlesboro Appalachian Regional Healthcare. And their CEO says if this bill becomes law, it could be devastating for this community. The hospital is the second largest private employer in Bell County, providing jobs to 250 families. The ER alone saw 13,000 patient check-ins last year. Middlesboro ARH CEO Michael Slusher says he's been keeping a close eye on this bill, and he's especially worried about the Senate version with its sweeping Medicaid cuts. Slusher says he's reached out to Kentucky Senators Mitch McConnell and Rand Paul, but he hasn't heard back. But we did get this statement Monday from McConnell's press secretary, saying in part Senator McConnell believes we should all be against waste, fraud, and abuse while wanting to protect rural hospitals and have safety nets in place for people that need it. This list also outlines 9 rural hospitals at risk in Tennessee, including Unicoi County Hospital. It's been closed since devastating flooding from Hurricane Helene. In a statement, Senator Marsha Blackburn's office said, quote, "We are removing the ability of fraudsters, freeloaders, and illegal immigrants to access benefits," and goes on to say, quote, "We are going to make Medicaid, Medicare, Social Security, and SNAP stronger and healthier than ever before." Here in Kentucky, the CEO says 80% of the payments made use Medicare or Medicaid. If funding was lost, it would be more than detrimental to the area. People would die. Another concern this CEO has is this is the only hospital within 5 counties that delivers babies, and he says they're expecting to deliver almost 200 babies this year. Reporting in Middlesboro, Kentucky, I'm Olivia Daig.
Now, if the Senate passes the mega spending bill, it will then go back to the House, and the president says he wants to sign it into law by the 4th of July. Congressman Tim Burchett's office said he is waiting to see the amendments in the Senate before commenting.
And by this broadcast, we have yet to hear back from other East Tennessee representatives. Congressman Chuck Fleischman or Congresswoman Diana Harshbarger have yet to comment. Kentucky Senator Rand Paul did say on the Senate floor he opposes the spending plan because it falls short of deeper cuts he wants to see in the budget. And you can read full statements from lawmakers and the CEO of that hospital in Middlesboro right now at WBIR.com.